Bueno, pues después de este excelente panel, vamos a dar lugar a la conferencia inaugural que va a cerrar este primer día de congreso, titulada Aportaciones del diálogo respetuoso a la justicia social, una perspectiva desde la alfabetización de la salud, y que nos la va a ofrecer la profesora Rima Rudd, que está en línea. Voy a introducir a la profesora Rudd. Ella es profesora emérita de la Escuela de Salud Pública de Harvard, en Boston, en Estados Unidos, y es fundadora y líder en el campo de los estudios de alfabetización en salud, en el que ha ganado múltiples premios por sus contribuciones. Actualmente participa en proyectos de investigación y políticas en los Estados Unidos, como también en Australia, Italia, Nueva Zelanda, España y Reino Unido. Y estamos convencidos desde la organización que sus contribuciones pues, van a contribuir a cerrar este primer día. Rima?
Yes.
Welcome to CICFEM.
Oh, thank you. I offer greetings from a very cold but sunny state of Massachusetts in the United States. I do apologize very upfront for my lack of language skills. I do not speak Spanish, regretfully. But I'm delighted to have a part in this important conference focused on science, feminism, and masculinities. I know from my colleagues in Barcelona that you've long been involved in efforts to shed light on prevailing power, control, bias, and inequities. And I applaud your efforts to correct misperceptions, reset established norms, and offer new visions for a more just society. I may be a bit of an odd choice to help you start your deliberations. My work is in public health, and I have been engaged in the last 20 years, 30 years, in examining barriers to health information, health services, healthcare, and well-being. I hope in my brief opening to provide a link between your efforts and my work in health literacy. And I do want to share just perhaps 2 insights from health literacy research and practice to help launch your deliberations. Health literacy, my focus area of work, emphasizes the links between literacy and health outcomes with the goal of reducing inequities and supporting social justice. Our early work in health literacy was quite frankly flawed due to a narrow focus on the skills and abilities of the public and to a profound misunderstanding of the nature of literacy. We were slow to understand that literacy is an interaction between a speaker and a listener, between a writer and a reader, between a designer of charts or other data displays and an observer. In addition, we've not paid sufficient attention to the context within which literacy engagement takes place. The social and physical environment of an institution or system facilitates or hinders someone's ability to be at ease, to participate, to act. Telling you a little bit more about my field of work, in addition to studies of the relationship of literacy and health outcomes, we've produced well over 3,000 peer-reviewed articles examining scientific and health materials designed for the public. Findings indicate that we have been poor writers and public speakers. We've been sloppy in our organization, careless in our use of jargon and numbers, dense in our reliance on unexplained concepts. Studies indicate that we, scientists, health practitioners, health activists, have not made important information accessible to the public. As a result, we hold a great deal of responsibility for limited health literacy. I'd like to bring one example from my work with colleagues in Fukushima, Japan, after the triple disaster of 2011. Not long after the earthquake, the tsunami, the failure of the nuclear power plant, society was awash with stories of the erosion of trust in scientists, in health practitioners, in media outlets and in policymakers. My colleagues and I noted that the line of communication was unbroken. Scientists had sent critical information to policymakers and professionals. This information was sent to health practitioners, such as public health nurses who were eager to share information with community members in their care. However, no one translated the scientific findings into everyday language for the policymakers, for the health professionals, for the community members. Government officials were not presenting consistent and understandable information. A mother, for example, who wanted to know if her child could play outside this week, was offered numbers related to radiation by a nurse who was not fully versed in the meaning or implication related to those numbers. It was no surprise that trust between the community members and the officials plummeted. Sadly, we've been finding that many of us in science, medicine, public health do not treat the word, the number, the format, the presentation of information with the same scientific rigor that we apply to the discussions we have together and within our discipline, and we apply to any research undertaken within our discipline. So for the moment, I invoke Paulo Freire and his emphasis on the importance of dialogue, our most intimate human encounter. Respectful dialogue must be focused on dignified exchange, attention to removing barriers that impinge on ease, on access, on action. Democratization of knowledge requires attention to accessibility of information, not just the availability of information. This requires attention to literacy, taking responsibility for clarity, explaining concepts, using a shared language without private jargon. This leads me to Paulo Freire's concept of praxis, the combination of reflection and action directed at the structures to be transformed. Communication is an essential component of turning ideas into action, but communication is challenging. When we examine struggles for social transformation, we find examples of battles between propaganda and reality, between belief and scientific findings, between archaic social norms and new ways of being in the world. Sadly, today's varied media options are more likely to generate separate realities than actual dialogue and discussion. Alarmingly, artificial intelligence threatens to confound reality with fiction. I ask what actions we can take in face of these profound challenges, and I offer those small insights from health literacy studies with its emphasis on clear communication, attention to the word, a rigorous approach to dialogue to help us in our efforts to bring insights into action to transform our society. In every aspect of our work, I feel very strongly that we need to pause and ask ourselves, how are we going to translate our dialogue into public dialogue? How is it that we're going to speak clearly with the public? How is it that we're going to bring our insights into action? And so how, I ask in conclusion, will your ideas and reflections generated in this important conference be transmitted to a broader public and to policymakers to support efficacious change in the very important arena that you're addressing today? I close now with a possibility or an opening for remarks from you that I can listen to or respond to. Thank you for your attention.